Did you know that between 20 and 45% of all heart attacks happen without the person realizing it? Well, that's right. When someone talks about a heart attack, the first image that comes to mind is that scene from a soap opera or movie. The character puts his hand to his chest in very strong pain, starts to sweat cold, falls to the ground. It seems that there is only this dramatic way of a heart stopping, but the truth is quite different. Many people suffer a heart attack and only find out months or years later when they have a routine electrocardiogram. That is why it is called silent, and today's subject can save your life or that of someone you love. I have been working with my heart for many years, and I have treated hundreds of people who have had a heart attack without knowing it. They felt something light, a temporary malaise, and thought it was tiredness, heartburn, or the flu. But the heart was suffering there at the time. So pay attention, because this knowledge is simple, but few people have it. Here in Brazil, heart diseases kill about 400,000 people a year, according to the Brazilian Society of Cardiology. And less than 5% of the population knows how to recognize the symptoms of a heart attack, even though it is the biggest cause of death in the country. Now imagine how many know how to recognize a silent heart attack. Almost no one. Before I talk about the signs you shouldn't ignore, I'll quickly explain what goes on inside. The heart is a muscle like any other, only it works nonstop. To function well, it needs blood rich in oxygen and nutrients. This blood arrives through the coronary arteries. When there are fatty plaques inside these arteries, the name of this is atherosclerosis, the blood passes through with difficulty. Suddenly, because of stress, greater effort, a change in temperature, or even for no apparent reason, this plate can rupture. The body tries to fix the break as if it were a wound, sending platelets to cover the site. But inside the artery, this plug becomes a clot that grows and clogs the vessel. The heart runs out of oxygen, and the cells begin to die within minutes. That's exactly what a heart attack is. The difference between classic and silent heart attacks is not in what happens inside the body, but in the symptoms. In the classic, the pain is strong, unmistakable. In the silent one, either there are no symptoms at all, or they are so light and vague that the person does not even suspect it. And the danger lies there. Those who don't feel anything serious don't go to the emergency room, don't do exams, and the heart accumulates scars. The more scarring, the less force to pump blood. And the worst, those who have already had a silent heart attack without knowing it are 3 times more likely to die from coronary heart disease than those who have never had it. A study of 2018 showed that about half of the people who survived a silent heart attack died in the following 10 years, precisely because they were not treated after that first event. Now, for you to understand better, I'll remind you what the symptoms of classic heart attack are, the ones that everyone should know. First, chest discomfort that lasts more than 5 minutes. It's not a twinge that passes quickly. It's a feeling of tightness, heaviness, burning, as if there was a brick there. That pain can go away and come back. Second, it spreads to other parts. Many people feel pain or numbness in the left arm, but it can also be in the neck, back, chin, stomach, both arms. Third, shortness of breath. The heart is no longer coping, so you feel like you've run a lot without running. Fourth, cold sweat and pale skin. The body reacts to the frightened pain with a rush of adrenaline, hence that cold and sticky sweat. Fifth, nausea and the urge to vomit because of irritation of the vagus nerve. Sixth, dizziness and may even faint. Seventh, a strange anxiety, that feeling that something very bad is going to happen. These are the 7 signs of a common heart attack. But in the silent heart attack, the story is different. The symptoms, when they exist, are so discreet that the person swears it is something else. And that's where the deception lies. Let's go to the 6 signs you can't ignore, especially if you have risk factors such as high blood pressure, diabetes, high cholesterol, smoking, overweight, or sedentary lifestyle. The first sign is unusual tiredness. You wake up, do your everyday things, and feel wear out as if you had been carrying weight all the time. We usually think, oh, it's my age. I work too much. I slept badly. Maybe. But if this tiredness appears for no clear reason, and you have those risk factors, don't ignore it. Many women especially mistake it for a passing virus. But persistent fatigue may be the only warning that the heart isn't getting enough blood. The second sign is mild chest discomfort. It is not that strong pain of the classic heart attack. It's a weird feeling, a small weight in the center of the chest, which comes and goes. Then the person thinks, it's gas. It was that heavy food. It's reflux, indigestion, and it can be. But if it comes with fatigue or appears in someone diabetic, it is better to go to the hospital to have an electrocardiogram. The third sign is cold sweat. You are sitting, resting in a cool place, and you start sweating. A cold sweat, different from heat sweat. The body is on alert. Don't think it's just a hot flash of menopause or anxiety. If sweat comes without explanation, especially if you have diabetes, seek help. The fourth sign is shortness of breath at the slightest effort. You climb a light slope, climb 2 flights of stairs, carry a shopping bag, and suddenly it feels like you've run out of breath, as if you've run a marathon. In silent infarction, shortness of breath can happen on its own, without chest pain. And this is more common in women. If you find yourself gasping for breath, doing things that were once easy, take it seriously. Dizziness can also come, and even fainting. The fifth sign is motion sickness. You wake up with a stomach upset, you think you ate something spoiled, that you caught the intestinal flu. But nausea without a clear cause, even more so if it comes with sweat or tiredness, can be the heart asking for help. Don't rush to the antacid without first thinking about the possibility of a silent heart attack. The sixth sign is discomfort in other parts of the body, but in a mild form. It can be a feeling of pressure on your back, as if you have a tight band, or a little pain in the chin, in the neck, in the upper part of the stomach. Nothing blatant, just an estrangement. As the pain is weak, the person pushes with the belly, takes a muscle medicine, applies ointment. But it may be the heart warning in the most subtle way possible. I've had patients who came for a routine checkup without any complaints. On the electrocardiogram, a scar appeared. When I asked them if they had felt anything a while ago, many remembered, doctor, a few months ago I had a strange indigestion, but it passed. Or, I was really tired, but I thought it was the heat. And here was proof that a silent heart attack had happened. The problem is that the scar does not go back. That piece of the heart has already died. What we can do from then on is to avoid a second heart attack and treat the risk factors. But the best of all is to identify it before it happens, or at the exact moment, to open the artery and save the muscle. Now, a very important thing, those who have diabetes are more vulnerable to silent infarction. Do you know why? Diabetes, when poorly controlled, gradually destroys the body's nerves. First in the feet, so many diabetics lose sensitivity and do not feel injuries. But so do the nerves of the heart. It is as if the heart is anesthetized. The pain that would serve as an alarm simply does not reach the brain. So if you have diabetes, pay extra attention to those mild signs: tiredness, shortness of breath, sweating, nausea. Your heart may be crying out for help at such a low volume that you don't listen. The good news is that a lot can be done to protect yourself. First, if you have already had a heart attack, whether silent or not, you need medicine. It's no use just changing your diet and exercising. Drug treatment is mandatory with medical advice. Coenzyme Q10, magnesium, vitamin K2. These things are not a substitute for the drugs that science has shown to save lives. Period. Second, if you have never had a heart attack and do not want to have one, attack the risk factors. Half of the heart attacks could be avoided with simple changes. Quitting smoking, for example, reduces the risk by 30%. Keep the pressure close to 12/8. Control diabetes with glycated hemoglobin below 7. Take care of cholesterol and triglycerides. If diet and exercise are not enough, there are effective remedies. And the diet, which is better. A very important study came out in the journal Lancet in May of 2022. He compared the low-fat diet against the Mediterranean diet in more than 1,000 people who already had artery disease. After 7 years, those who followed the Mediterranean diet had fewer heart attacks, fewer strokes, and fewer problems. What's in it? Extra virgin olive oil, nuts, fatty fish such as sardines and salmon, lots of fruits, vegetables, legumes, and whole grains. Yes, it can be more expensive, but medicine also costs money, and health is priceless. Also, practice regular physical activity. At least 150 minutes a week of moderate exercise such as brisk walking, swimming, cycling. Get 7 to 9 hours of sleep a night. If you're overweight, try to lose a few pounds. And a detail that few people talk about: loneliness and social isolation increase the risk of heart attack by almost 30%. So cultivate friendships, maintain bonds, participate in groups. The heart also needs affection. Finally, have a cardiological checkup. The exams are getting better and better. For those who have many risk factors, the doctor may order a coronary CT angiography, which is an exam that shows inside the arteries if there is already fatty plaque. It's not for everyone, but for select cases, it can literally save a life. I know it may seem difficult to recognize a silent heart attack because the symptoms are vague, and indeed they are. But now you know what the 6 signs to keep an eye out for: unusual tiredness, mild chest discomfort, cold sweat for no reason, disproportionate shortness of breath, nausea and discomfort in other regions, such as the back, neck, or jaw. If you experience any of these, especially if you have high blood pressure, diabetes, high cholesterol, or are over 45 years old as a man or over 55 years old as a woman, don't wait. Go to an emergency room, ask for an electrocardiogram and the dosage of cardiac enzymes. It may be nothing, and thank God. But if it is, you'll be on time. Now do your part. Share this information with your family, neighbors, friends in the walking group, church, bingo. Many people still die because they don't know that the heart can speak softly. You can save a life just by passing this knowledge on. Take care of yourself, and see you next time.